Welcome, everyone. Welcome to today's podcast. Today, my guest is Dr. Shadi Vahdat. Now, she's an internal medicine physician with over 20 years of experience, who later expanded her expertise in integrative medicine. Educated at UC Berkeley as well as Albert Einstein College of Medicine. She has worked across various healthcare settings, including nonprofit clinics, private practice, and academic hospitals. Dr. Vahdat dual role as a physician and caregiver fuels her commitment to making healthcare more accessible and understandable for all. Having said all of that, welcome to my podcast.
Thank you so much. It's an honor to be here with you.
We had a bit of a chat beforehand and I got to get to know you. And the thing is, during the show, even though she is Dr. Shadi, we'll call her Shadi. But I want, having said that, I want to start with that because you are a doctor. So give us a little bit of intake of how you became, what made you become a doctor and what sort of practice did you learn and did you actually start, I guess, practicing?
Well, I am from Iran, so my parents, like most Eastern parents, I guess, really pushed certain fields. As you've probably heard, it's either a doctor or engineer, and I just happened to become one of those. So, from a young age, I was sort of on that track, and I was a good child and listened to my parents. And I think I just sort of went through what needed to be done to sort of buff up the resume, get into, a good medical school. And so I went the conventional medicine or Western medicine route initially. As you mentioned, I went to UC Berkeley for college and then Albert Einstein and learned, what we learn in Western medicine. And so that journey was fine and it was satisfying and it worked until it didn't. And even when we spoke before we got on, we kind of talked about the turning point in my career and how a good friend, actually at that time, a friend who was my age, 37 or 8, got diagnosed with metastatic breast cancer. That event really pivoted my career and the things that I got interested in after. But before that, actually, I had my own health challenges. And that, along with my friend's journey, really kind of made me go into the holistic route a little bit more. And so my own health issues had to do with autoimmunity. It took a long time to get to the correct diagnosis. It was very frustrating. All of my strange symptoms started in the first year of internship, which is quite stressful. And now as I learn more, a lot of people in medical training, because of the extensive hours and poor sleep and stress, really come down with a lot of health challenges. So for me, it was the same. It took a long time, and finally, like I said, I got diagnosed with autoimmune issues, undifferentiated connective tissue disease, and the things that were suggested. This is all related to how I feel about cancer, but what was suggested to me were conventional treatments, actually immunosuppressives, very strong medication, biopsy, various things were proposed, and I said, no, thank you. That all sounds great, but let me look. It didn't resonate with me at the time. And I had gotten multiple opinions. I don't say this to digress from cancer, but because I think it's relevant no matter what diagnosis you have, in that what I've learned throughout all these years is that you can't stop with the first, doctor's opinion. And the first doctor happened to actually write the textbook on, autoimmune conditions. So she was highly respected. And so there's no reason for me to question her authority or her knowledge, but it just didn't feel right. And I thought, well, let me get another high level opinion and then another. And so literally I went to multiple medical centers in Los Angeles and got different opinions. And they were so vastly different. This is not unlike my friend's journey with cancer. And I think when you have vague symptoms or an unclear diagnosis or a serious diagnosis such as cancer, you owe it to yourself to get some good opinions from different experts, high-level experts. And so when one person said, you just need to take a yoga class, and the other one said you need a biopsy, and the other one said take medication, I thought, well, gosh, it must not be totally clear. Because if it was, clear to everyone, all these experts would be saying the same thing. So that kind of gave me the impression that I have some time to figure this out. And for myself, along with my friend's journey, that started a quest to do more learning, and it happened to be on the holistic track.
Yeah, wow. So that's the thing too, because you're, and thank you for sharing that, because what you're doing is, as we know, we're not here to condemn Western medicine or anything like that. But as you know, that, you go through a protocol. All doctors, I hear the same thing. Doctors aren't, up to date. They're not learning as we're going, evolving. They're sort of learning the same sort of method. But like you said, it's not like you didn't learn as a doctor what you needed to. You've got what you learned as a doctor, and then what I'm hearing in my hallucination, then doctors make their own sort of diagnosis along the way of what's best for you. Like you said, it's not like it's a umbrella and you say, well, I've got this, and they all say the same thing. It's like that they've all sort of put their intake of what's best or what they took out of it. So my first question is, before we go into your friend, is what did your fellow doctors think when you started questioning their, and changing, I guess, to holistically? What did they sort of think about that? And you can be honest and open.
Well, they didn't know about the holistic right away, because I just went to another kind of conventional doctor down the road, so to say. And I never forget the first doctor who did want to do the biopsy and put me on, very strong medication that would depress my immune system. And she had labeled me as having, an autoimmune condition. And I remember getting on the phone and I said, I just told you a set of symptoms. You don't have the biopsy. You don't have a diagnosis yet. This is presumed. This is what you think. Why did you label me with having this condition? And we actually kind of got into an unpleasant back and forth. And she said, I need to put a code so that I can bill and can get paid essentially for this visit. And I remember thinking, wow, this person may have been great in their field, might be a great researcher, but not all doctors have great bedside manners. And as a patient, she lost my trust. Like, I did not want to work with her because I seemed to be a billing code to her. So that was not a good way to start, because to me, it was like, we're still trying to figure out what I have. So don't label me with something. And so it did not go well. So I think there's like multiple levels. I think just getting a good conventional diagnosis is really important, because if you don't have the proper diagnosis, you can't even speak about prognosis or treatment. And while people may think, oh, I'm at a university-based hospital, or look, I'm with this very respected doctor, I would say it doesn't matter where you are, who you're talking to, still always at the back of your mind, just know that that is one doctor's opinion, because and once we go into my friend's story, that'll become clear why. But you got to get the proper diagnosis first. And a lot of that depends on, what is the biopsy show? Did the biopsy get the right chunk? Did it clearly show what you have? What about the imaging? Was the radiologist, did they read it correctly? How did they interpret what they saw? And again, we'll go into a specific example with my friend. But if you don't have the diagnosis right, you can't get the rest of it right. And so that's what I was in search of. So it took a little while until I got into the holistic side. And honestly, I never came back to the conventional doctors because I ended up training in acupuncture and functional medicine and other things, and did a lot of things on my own. And then ultimately I worked with, a team of doctors.
Yeah, wow. And thank you for sharing that, because, a lot of people don't actually understand and how can I say, I am grateful that you're speaking to get second opinions and that, because we're in a world where we believe that our doctor is God. Whatever the doctor says is right. No, no, no. I remember sort of questioning my parents' doctors and saying to my parents, get a second opinion. Oh, don't you dare. I'm not going to disrespect our doctor. He's been there from, day dot. And I'd be like, yeah, but I get other opinions. And they were like, no, 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 my doctor said. And I'm not trying to disrespect them, but it's true, like what you're saying, because a lot of people put all of that, they put all their everything, their life in their doctor's hands without actually taking it back and saying, okay, you know what, you're my doctor and we're going to work together. Yeah.
And there's definitely a power differential and a knowledge differential. And so I think most people sort of feel like, what do I know? So, I'll sort of listen to this person who's the authority. But a lot of what I speak on or write about has to do with exactly that nobody knows your body better than you do. You have intuition, and when someone's not listening to you, when somebody's ignoring things, when you're being brushed off, when something's wrong and the doctor doesn't think so. So listen to those little voices that tell you maybe this is not the right fit. And I think the other point to that, which also is something I talk about quite a bit, is that not only is that authority differential sort of big with a layperson versus a physician, but when you have cultural implication, meaning some cultures, it's even more. So, that gap is even bigger. So coming from the Middle East, or, from what I've seen, some of the other people from all over the world that I've worked with, you don't question the doctor, you don't speak, you don't ask questions. And so nowadays, I think, as I'm really big on advocacy and speaking up. And if you can't speak up yourself, then you need to have someone with you who can help.
Absolutely. I agree with you, because like we're saying, it is that respect you have. And like I said to you earlier, I can't call my doctor by her first name. I still call her doctor. Why? Because it's a sign of respect as well. Because, what would I know? But I think what we're trying to say is, you taking control and working with your doctor is a lot easier and a lot better than giving everything to your doctor and expecting miracles when it's not, like you said earlier, you're not being diagnosed correctly. So if you don't know the diagnosis, what are the process of healing if you're not getting that sorted? And that takes us, I guess, to your friend. So your friend's breast cancer diagnosis, it was a poor diagnosis that got you interested in holistic. So take us on that journey.
Yeah, I think if I remember correctly, she was in her late 30s, and so was I. We had young kids that went to school together, and she's a good friend, and I didn't see her for a while, and then some time passed, and I thought, well, what happened? And her husband actually reached out and told me about the metastatic breast cancer diagnosis, and it had seemed that she'd gotten diagnosed at a very respectable hospital and medical center in Los Angeles. And, there'd be no reason to think that this was not a good high level, evaluation. She was told, she has metastatic with spots. We were talking about spots in the liver and spots in the spine. And she was given 6 months to live. And she had actually kind of accepted that. I think she was off to traveling and trying to make the best out of those 6 months. Her husband actually reached out and said, please talk to her. And really, at that time, I didn't imagine in a million years that the diagnosis was in question. I thought metastatic breast cancer is metastatic breast cancer, right? I mean, there should be like no fudge, no room for fudging that. I mean, how can that be mistaken? I ended up offering, because I worked at a different medical center, I said, let's just go get another opinion. And I just thought, we're just going to go. It's still metastatic, correct? Well, I very clearly remember taking her to one of the best oncologists that I knew at an academic university-based hospital. The doctor was very well known. And within that one visit, our entire world changed and my friend's world changed because he said, well, let's see. Do we know that it's metastatic? How do we know that this little dot in your liver and this little dot in your spine actually represents metastasis? And so, again, never in a million years that I thought we would actually be questioning this, because to say that it's metastatic and she has 6 months was a world apart from is it even metastatic or is it localized? So what proceeded to happen was that within that week, I think within days, she was set up to have biopsies of these little dots in the liver and the spine. Well, they were too small. Nobody could get the tissue. And so the doctor said, this is a very young patient. You want to be as aggressive as possible to give her the best chance. So who knows, maybe there's scar tissue. And that's why I talk about the pathologist. I'm not sure everybody who's non-medical actually thinks about this, but the biopsy matters. What kind of tissue you got? The pathologist matters. So what are they looking at under the microscope? The radiologist matters. That radiologist note in that the original medical center said probably or most probably metastatic lesions, because he assumed. You cannot assume. And so the doctor, if they look at that report, so do I trust that radiologist? Oh yeah, it is metastatic. Or do I need to make sure by trying to do a biopsy? So that's why I kind of emphasize that getting the diagnosis right will completely change things. Well, they couldn't get the tissue. So the second doctor, the second opinion, did not presume that it's metastatic, ended up sending her for surgery, a double mastectomy, and treated her, as if she was not a metastatic patient. And all I could remember from that visit was just my friend just being completely in shock and just saying, well, she started asking things like, but what about the deodorant that I use? Or what about the food that I eat? And I thought, I can't even tell you the feeling, but I thought, the patient wants to have some control and wants to know what they can do. And this high-level doctor who was so focused on, let's get you this active treatment, completely had no answers for her. And anyway, she ended up doing a lot of different things and really incorporated. She did get surgery. She actually went back to school. She changed her whole career. She incorporated a ton of holistic modalities up until the very end. And she was with us for 13, 14 years after that.
Wow, that's from 6 months. She outlived it for 13 years, 12, 13 years. And it's a shock hearing this as well, because like you're saying, here you are getting died. And this is the one thing I don't like, and it's just me not liking. I don't like when doctors actually give people 6 months, 12 months, because a lot of people actually fulfill that, what I call contract in life. Yeah. And had she not met you, she would have died in 6 months, because she would have, her whole body, her whole mind, her whole, psychologically, she would have changed that to say, yep, I'm dying, which probably would have created other issues because it wasn't addressed properly. So, it is really important, like you're saying, to get a second opinion, and not just the probably. I quite like that, because yes, your pathology report needs to tell you exactly what it is. When I have people say I've been diagnosed with cancer, I always go, oh my goodness, first and foremost, I'm so sorry to hear that. What did the biopsy say? Oh, I haven't had the biopsy yet. Well, okay, then let's take a step back, because I've had biopsies and they're benign. So it's like, take a step back. You know what I mean? Like, wait a minute, just one moment,
Yeah. If I hadn't had the privilege of, doing all the training, that particular experience taught me so much. She ended up, really paying attention to diet and holistic modalities and energy heal. She did so much. She was the perfect patient. And really opened my eyes. I mean, really opened my eyes. And based on my own health issues and that experience, I mean, it just, I went down a different route. And um, now, I've had the privilege to see a lot of people using holistic treatments alongside, Western medicine, conventional medicine. And I've seen such things that would be called miracles, really, that I think, I mean, I've seen people with metastatic lung cancer and they've gotten over that. And, this is not like the majority, but because of what I've seen, I think it's really important that when you get a new diagnosis, as anxiety provoking and stressful and scary as it is, you have to do your best to really kind of sit back and just take a deep breath and go through the motions of really just kind of saying, okay, this is what this one doctor says. Now let me like work through it systematically and kind of not let the panic take over. It also happened to multiple family members where, they just, like you said, people throw in the towel and give up and they don't fight and they make silly decisions. And I can't say enough on that topic. So I'm really big on second opinions and just really weighing your pros and cons when you're speaking to different kinds of providers.
I'm so glad you brought that up because that's exactly what I did. I did the whole pros and cons. It's like the thing is, I love doing what I do, and it's not just hearing about patients, but it's also hearing other, like from people who have got the experience, as in they're medical doctors who are saying exactly what I've been saying so long now, probably for the last 6 years, because I was diagnosed 6 years ago. Get a second opinion. Don't just, throw in the towel. Just make sure that everything that's being put forward, is that my only, options, or is there other options to do things? You know what I mean? And a lot of people don't see that. So it's quite stressing knowing that, like we're saying, some doctors, you can ask them a million questions. They don't care. Some question, you ask one question and already they get on their back leg and they're like, they get into that defense mode. Are you questioning, my medical experience? And it's like, well, yeah, but you can't say that. You know what I mean? And that's where, like you're saying, and you seeing it firsthand, how this is so. In this particular scenario, and I'm not sure, you probably saw him in other scenarios where something was misdiagnosed, and it's not misdiagnosed because she still had cancer. She still had breast cancer, but the type of breast cancer was misdiagnosed. So, and that's really important. So
The treatments that were offered to her were so different. So the initial doctor was just, didn't even offer chemo, but the second one did. So the treatment was completely different. So based on whether it was they probably had the right pathology report, but whether it was spread or not dictate a whole different treatment course. And well, there's lots of things I can talk about, but
yeah, no, please go ahead. So, you know what I mean? Like you are the question of, how important it is for a second opinion, to value the accurate diagnosis with a biopsy and imaging, lack of guidance on lifestyle medicine. So take us through this whole journey. Absolutely.
Yeah, I think one of the things I write quite a bit about in the book that I recently wrote is really knowing your provider and having realistic expectations of what they're going to deliver or what kind of information they can provide you. And so I don't know what it's like in Australia, but I don't know if it's as challenging or chaotic as it is here, but especially when it comes to cancer doctors or providers that tell you that they can help with cancer, I think it can be very confusing. So here we just talked about just getting the proper diagnosis within conventional medicine, right? We're not even talking about, anything alternative. I think the frustration from patients come about when, like my friend, when she was saying, what should I eat? What about this deodorant? Is it toxic? Well, it's really important. Like, what is this guy sitting in front of me? What are they highly trained in? And I really believe that you need a team, really, to have the expectation that one person knows it all and is going to be the expert in everything and will know what to eat and will tell you whether you should eat onions or not and how to de-stress. Like, that is unrealistic. So this particular doctor was highly respected oncologist in a university setting. And so probably, I think most people know that your regular doctor, at least in America, I don't know what it's like there, has almost an internal medicine doctor has minimal to none lifestyle training. I do not remember. Hopefully, I was not asleep if there were some nutrition classes, but really, I think the last time I looked into it, people in medical school make 8 hours, 16 hours, I don't know, but it's very minimal. So you want to know that I may be able to ask him what the best chemo is and whether I should see the surgeon or not, or whether I should get the radiation or not. But really, you don't want to ask that guy what you should be eating because that's not what he knows anything. I mean, unless he has additional training, that is not what he studied in school. And so when I say you need a good team, is you need a good oncologist, you need a good surgeon, you need to do your research on all of these people, you need to the best radiation doctor if that's what you need. I think a nutritionist or a dietitian who's very knowledgeable, especially with cancer, that is a good person to have on the team. There's various kind of holistic providers like naturopaths and functional medicine doctors, and um, I'm sure I'm forgetting lots of other types of practitioners who will have the ability to look at uh, things kind of below the radar, look at metabolic numbers, look at blood sugar, look at insulin, look at inflammation, and will actually care about it and know how those are drivers of a worse prognosis with your cancer. So the oncologist is not going to be looking at your nutritional status or your muscle mass or your fat mass or how you're eating or your inflammatory foods or your stress levels. So you need someone to deal with that. And something that I think I think speak about is just the psychological component and the spiritual component. And for sure, the oncologist is not talking about that piece, but dealing with childhood traumas, past traumas, the trauma of going through the medical system, you need a different individual who's knowledgeable in that. And it really does take a team. And really, having seen my own family member, my mom actually had breast cancer recently as well, just seeing how overwhelmed you can be and sick from all the treatments, and then having to navigate not only all of your health, but insurance and billing and the finances. I mean, it's a lot. So,
Yeah.
so
Yeah.
if you can form a team that can address all of these levels and, have family or help, or actually, again, I don't know if it's, do you know about patient advocates? Are there patient advocates in Australia that you can
Well,
hire?
the thing is, I don't know of any, but because most of the people that I speak to here, unfortunately, it's that whole, once you get operated, like you said, your oncologist tells you what chemo, radiation, or whatever it is you got to do. But then when you're sort of on the other side, or almost on the other side, or even going through it, it's like, well, go home. And people go, well, what now? What do I do now? And there's no support that I know of. People actually say, like doctors, no, I shouldn't say people, but I've heard of surgeons say, or oncologists say, go and see a psychologist. But again, that's really broad as well, in the sense that you're probably not dealing with your traumas, like you said. You're probably dealing with a double mastectomy. That's different. Talking about someone with a double mastectomy is different to talking about someone with traumas. So you got to make sure that the people that are guiding you are able to support you in those areas. Like, I don't know, doesn't a psychologist know what it feels like when you have a double mastectomy? Not unless they've had it. So you know what I mean? There's a lot more people coming out and saying, well, hey, I've got this experience. You can speak to me. But it's not something I remember, the book I got when I was diagnosed did not say anything about that. It was more the medical side. Here's the medical side, go home and deal with everything else. And like you said, the foods, are you getting enough sleep? Are you resting? Are you changing the mindset? Things like that. It's not spoken about at all.
Definitely. I don't know if the oncologists are speaking about that. I think more and more, at least in the US, there's more of a holistic or integrative oncologists. They're probably, I can count them on one hand. But there is a growing field, and it may be even more so in other parts of the world where the oncologist is also knowledgeable and doing other treatments and maybe incorporating some complementary therapies like acupuncture or maybe doing fasting or whatnot. But so far as I know, for the most part in the US, you would not expect to get that from your mainstream oncologist. You need a separate person, and there should not be frustration. You just need to know who's across from you, what is looking at their credentials, looking at their training, looking at their expertise. That's on the patient, because again, in the US, I think marketing can be misleading. I can't tell you how many times non-doctors are calling themselves doctors. And I can't tell you the number of times I've seen people who have no business talking about cancer are saying they can heal cancer. So it is on the patient. Marketing can be flashy and, very good, but you got to do the homework, because that's the other thing that I've seen once kind of stepping into the holistic side is that there could be some misinformation out there, and patients are desperate for help. And so you got to really, really do your research on that end of things if you decide to incorporate those modalities.
Yeah, absolutely. Because the thing is, it's not about finding a guy who says, like we were discussing before, I'll just pray to the rainbow and the sun and it'll heal you. You got to be real about these things. And going back to you saying, you need a dream team, or I call it a dream team, that you get a group of people. I had 5 people around me that, I had them not all holistic and not all Western medicine, but they were all giving me information of things I should try and what I shouldn't try. But sitting around, it was like a board. It was like almost a disciplinary team in my case, because I really wanted to tackle this and I didn't have all the information. So like you're saying, I went to people who had more information than I was. And, and being able to say, but I've heard of so-and-so. Yeah, don't worry about so-and-so, because it's all, fancy and, bells and whistles. And the thing is, I always say, if someone really wants to heal you, they don't need all the bells and whistles behind them. So it is a matter of finding, even holistically, like you're saying, there's so many, I hear it all the time, I could tell you a million stories. I really can. And one story was, because I do a lot of shamanic healing, but that's on a psychological and on a spiritual level. When I say I used it to heal my breast cancer journey, I healed it as part of my journey because I needed to heal the traumas in that. But then I was over in Peru recently, where I hear a lady who tells me that she takes this poisonous frog and it healed her of breast cancer. And I was like, oh, the traumas. Oh, no, it healed me of breast. And I'm like, okay, you got to stop saying things like that, because I'm not saying it's not real, but it's not real. I've known the shamanic world for like 15 years, 10, 15 years. I can't remember. And it's there to heal you because your body knows how to heal itself. But like we're saying, you need other things to help you heal. I didn't just do, shamanic healing. I did Ayurveda. I did, what else did I do? I did a lot of, natural remedies and things like that, as well as doing all my tests. But I used each module for what I needed. It wasn't just one, like you were saying, it's not just one one umbrella for one thing. It's a variety of different things, but also being mindful, being mindful. Who is this person? How many people have they healed? I've interviewed Okay, I'll give you an example. When I first got diagnosed, you're going to laugh because I don't even know what it was called again. There's a lady who she was a lady in this case. She put a set of headphones on me, and apparently the music was going to find where my cancer was. This is a true story. This is a true story. So we didn't tell her. We went in there, and apparently if there is something not right, it's going to show up. So what she did was she put these headphones on me. And she's like, oh, I'm going to find where your cancer is. Oh, no, I'm going to find if there's something not right. She didn't know if I had cancer, autoimmune, bone problems with my bones, whatever. So after she did all of this, she said, oh, you are clear. Now, the person I went with, who was part of my dream team, who recommended her, he looked at me and I looked at him and I looked at my husband and we all looked at each other. And she's like, wow, you got nothing wrong with you. Now, this is the reason I'm saying it, because I don't know if it was true or not. And I'll tell you, but what happened was we said to her, well, he said she's been diagnosed with breast cancer. Oh, the second time she went around, oh, there it is.
Found it.
Exactly. And I remember him saying, Grace, I am so sorry. I said, don't be sorry. We're trying things out, aren't we? We're finding things out to help me. So what I'm trying to say is not everyone that goes out there and says, oh, I've heard of so-and-so. You got to make sure that they've got some credibility behind them. They've got something.
I'm so curious when you were saying you had your dream team, if this dream team was willing to speak with each other.
Yes, they were. Actually, that's why they were when I first put them together, I got diagnosed. I was in the cast pot just crying. And my husband said, I need you to put 5 closest people you want in your dream team. I need you to contact them right now. And I did. And they dropped everything. And I think the following day they came over. And as I said, there were people in holistic. There were people in Western, so into Western. There were people who didn't know the difference between either one. But they were there because what they were doing is asking the questions. Well, if you think this is right for her, back it up. If you think this is right for her, back it up. Don't just say it, So that's why they really, and we had one guy, we called him MS-DOS because he knew everything on the internet. But you know what I mean? But he was like, no, again, true story. I speak openly. I had a friend who gave me tablets. And I remember getting these tablets straight away. Well, actually, this was like within a week or so that I'm still going through my process, or 2 weeks. I ended up getting tablets. One of the guys in my dream team took the bottle and he said, don't take these. And I said, well, but why? And he said, because there's an ingredient in there that actually goes against it and it creates more cancer. I wouldn't have known, because why? Another friend who I trusted said, hey, these are what they tell us to take. These are some, herbal medicines or whatever it was. But then there's an ingredient in there that in my case, I always say in my journey, in my report, it would have gone against what I was doing. So, you got to look at all of these things, don't look at just the little things, look at the fine prints as well, because I'm so glad you brought it up, because you got to look at where it stems from, not only traumas, but have you got a problem with your diabetes? Have you got problems with high blood pressure? Have you got other problems? You don't want to start doing a treatment that's going to cause that also to get more problems, because you don't want more problems. You're trying to fix yourself. The last thing you want is tablet A fixes you, but then tablet B fixes tablet A, and then tablet C fixes tablet A and B. You don't want that. So,
yeah, I was going to say something. I'll try to hold back.
No, please.
Yeah. Well, I mean, I'm just thinking of, my primary care doctor, where it's like, a pill for this, a pill for this, a pill for this. Whereas if you make one lifestyle suggestion and you really sort of work on that, I don't need these 3 pills. So, you keep adding pills and it's like, you know how that goes. Then there'll be more pills the next month. But I think, well, as you were saying that, I thought, well, you really did have the dream team, because I don't know that that happens super often. And I think that's the challenge, that practitioners are not working as a team. I think things are changing. I think, some very respectable medical centers are changing this, and they're embracing lifestyle medicine and integrative modalities and herbal treatments that have data behind them and that are safe. I think definitely things are very different from when I started medical school, but I think I still would love to see if a patient can really find all these different people who are experts in their respective fields and they're actually communicating and respecting each other, you really do have the dream team. And that is the best case scenario, because also what I see, at least in the US, is they're going to the regular doctor, and then they're going to the holistic doctor, and then they have a whole cabinet of supplements or herbs, and the regular doctor doesn't know anything about all these things that they're doing, and these super, sometimes unsafe fasting and herbs and things that are counteracting the conventional treatments, and they're not being open because they don't think that it would be accepted if they brought up all this other stuff that they're doing on the side. So you can be creating more harm for yourself, and needing to be clear with everyone, and finding people who respect that is what that respect what's important to you. Because as you and I know, there are doctors that if they're here, you are interested in herbs, they may not want to work with you, right? And sometimes people don't have the luxury of multiple doctors to pick from. If their insurance says go with Dr. A and you have Dr. A and Dr. B, that's it. You got to go with Dr. A or Dr. B. But if you have the luxury of choice, then try to find people who respect your wishes and who are willing to work with you and work with the other providers you want on your team. I think that's super critical, and I'm so happy to hear you found that.
Yeah, and it's really, like you said, it's really important though but also to understand that if you are with Doctor, say A, you can do some get someone. When I say people on my dream team, my dream team weren't made up of doctors; they were made up of friends, and they weren't experts as doctors. But what they were doing is they were finding out there other doctors, other medicines, other ways of healing, and they're bringing it to me. And you could get someone in your dream team to do that for you. So like you're saying, you might decide to do chemo, or you might have to do radiation. But hey, you can get a really good friend or a family member who can help you find something that helps you along the way. It's like finding, well, yeah, you're doing this, but hey, I found this. And it doesn't contradict what you're doing. It actually just helps you along the way. So I think it's really, like you're saying, it's really important to get someone in your dream team. And that's, I guess, my question, because I wrote it down here, is what are some sort of people you would recommend in someone's dream team besides friends and family? Well, I'm not talking about friends and family, but as in what type of other options can that dream team bring to you to help you on your journey?
You mean in the medical field, like an acupuncturist or chiropractor?
Correct. Absolutely. Yeah. Yeah.
I mean, like I said, I think, any kind of cancer, you're going to want the oncologist who's very, highly trained, and we kind of clump all breast cancer together or all cancers together. But let's say you have one of the rarer types, that then again, I don't know sort of how the system works there, but in the US, if you have cancer, if you have a rarer cancer, you want to be going to the center that has some experience with what you have. And so it's important to find that person. You may need to travel. But again, you may need a good surgeon. Those are sort of the conventional sort of providers. On the holistic end of things, I think, I personally have experience seeing in the past, in different places that I've worked. I do have experience doing fasting protocols with patients with cancer getting chemo. Sometimes if you work with people knowledgeable in that, it can decrease side effects of medication and really be helpful for dealing with the metabolic aspects, like we talked about, the diabetes, the inflammation, all of that. But it really needs to be done safely. I don't, I say, if you're going to do fasting with chemo or with treatment or even not with chemo, then work with someone who's very knowledgeable, because even fasting can be unsafe. And so other providers, again, acupuncture could be great for the pain and the neuropathy. I think, I myself am trained in functional medicine and functional medicine. Do you have providers who are functional medicine in Australia? Is that a term that's familiar?
Give me an example of functional medicine.
Yeah. So functional medicine is its own training. So there could be, they could be different types of providers. So nurses, doctors, chiropractors, lots of different types of providers who train in this modality. And what it really means is just getting to the root of the problem. So let's say I come with insomnia. So if you see a conventional doctor, they'll say, here, take up this prescription medication for your, insomnia. You might see an integrative doctor, one that is familiar with herbs, and they'll say, here, take melatonin, here, take kava, here, take L-theanine or magnesium, whatever they're going to. And then sort of in the functional medicine approach, we're looking at like, why are you not sleeping? So we're getting to the root of, we're not just switching a prescription for herb, but we're actually looking at sort of, what is it? Is it high cortisol? Is it low blood sugar? Is it poor circadian rhythms? Is it hormonal imbalances? Is it toxins? So we're actually doing tests to see what is it, so that we can target specifically. Maybe you need something maybe you need a supplement or an herb or a non-medicine intervention to bring your cortisol down. Maybe you need to eat something and balance the diet. So that's sort of a growing field here. And I'm sure there must be some providers out there because they're all over.
There's actually one at the moment that I heard of in Sydney that you can do a blood test, a thorough blood test. But myself and my husband, we're actually thinking of coming to the US to do a specific blood test that shows everything. So then we can actually narrow down, because he's I might feel all over the place. Is it menopause? Is it perimenopause? What is it? He's also going through some testosterone levels and stuff like that. But every time he's had it, doctors really brush that off here. No. Just do your local, like your cholesterol, your kidneys, your liver, and then they stop there. But so no, to answer your question, there is one place at the moment that I know of, and that's in another state where I live in. But it's not very known here, no.
Yeah, over the years, it'll probably change because, again, it's a growing field. But you can see how personalized and specific it can get, because everybody's coming in saying, I can't sleep. But in a perimenopausal patient and a patient exposed to a particular toxin, or patient with nutritional deficiencies or gut imbalances, it's going to be a whole different treatment. So you get really... So, again, I've had patients who are getting their breast cancer treatment somewhere else, but I'm doing that under the radar detective work to see they got the chemo or they got these heavy duty treatments. What's their gut health now? What's their, what's the balance of good and bad bacteria? What's their, do they have leaky gut? So you can see, and sometimes I don't really know. I think there's some overlap between naturopathic doctors and some chiropractors. A lot of people are doing these tests now, but that's why I say you got to do your research to see what is the person's training, and to get the person who aligns with your needs. I personally, not with cancer, but in other very serious life-threatening diagnoses, have found energy healers and Reiki treatments. At one point in our life, it was like what I needed. And we complemented it with all the other stuff. But I never forget a Reiki healer that worked with us. And I remember her guidance as being sort of the thing that I needed the most, because with one family member's diagnosis, we got to the point that it felt like we had exhausted all options. Like we thought we were at the end of the road. And I never will forget that this person who worked with us said, you just need to envision the outcome that you want. You're not going to think about how that's going to happen. You're not going to think, oh, I'll go here and get that consultation. No, no, no. You're going to envision the outcome. Whatever the best doctors have said, great, that's all fine. But you're going to just sit there and focus on the outcome that you want. And at that moment, that was one of the best advice that I got. And in fact, that's something that we did practice, and the outcome was positive. So I think, again, this is, for me, that she was part of our dream team then. But therapist and different type of therapist, and probably a lot more about that, and people who can help with trauma, and there's lots of different modalities, but I think these are all very important. Like I said, someone who's going to help with nutritional guidance is huge. But that's, I think, and I think, again, I keep going back to that patient advocate. It could be your neighbor, it could be your friend, it could be a family member, but all of this is overwhelming. And if you have someone who can help kind of hear things objectively, take notes, have questions, translate, hear the things that you're too stressed to hear, it could be a non-paid person. And again, here we can hire people to do that, and not only deal with what the doctor's saying, but also help you with bills and all that. So this is a dream team.
Yeah, I agree with you. And it's the thing is, like I always say, you got to heal the mind, the body, the spirit, the soul, psychologically, emotionally, spiritually, and physically. So you saying about this Reiki person, this is that shift in energy where people think, oh, I don't know. I mean, you speak to doctors and go, oh, I went to a Reiki person to shift my energy. They probably look at you strange because they're not educated. But you know what I mean? But it's you need that. You need to find, we had, one lady that came with us to Peru who's been diagnosed with renal cancer, who's a friend of ours. She would always say the words, oh, when I get healthy. No, you are healthy. Now, that 6 weeks that she was in Peru, when she got back, her doctors couldn't even recognize her because she was so different. Because why? We weren't changing her body. We weren't changing anything about that. Yes, her body was healing because she wasn't doing chemo every second week, but it was her mind. It was her spirit. She's come back in a positive way. Now, again, I'm not sitting here going her cancer is gone. She still has it, but her mindset is a lot stronger than what it was before. So it is touching on that. Like you're saying, it's not just the physical side. It's not just your medicine. It's also other things, acupuncture, yoga,
You're mentioning yoga.
yeah. Yes, definitely. I mean, when I just spoke to someone who the podcast, is coming out today, but what it was is she was telling me how she was talking about Ayurveda, and I'm like, I've done Ayurveda, but people think it's a matter of going there, someone feeds you herbs, you get a beautiful massage, and you do a couple of things of yoga. No, it's not. It's shifting a lot of things internally. And I was purging, and a lot of people thinking, what do you mean purging? Yeah, I was crying a lot because that was all the emotion that had to come out. So a lot of people who tend to be, I've got to be strong, I've got to be strong. It's like, well, strength for me is vulnerability. So it's like, well, the moment you can just be, and like you say, you have a great team around you where you question it. You question it all the time. Like, okay, how is this working? And I'm sure you would say this. If something isn't working, you would try something else. You wouldn't give up. You would just say, right, that didn't work. Let's try something else.
And
so
I think what I loved about where we started, maybe it was before you started recording, is you didn't sort of opt for holistic and say, forget my surgeon, forget my other doctors, but you were actually checking back and monitoring. and assessing, okay, I did X, Y, and Z, whatever that X, Y, and Z is. Okay, now we're going to do another imaging or talk to my doctor or check my labs or however you're assessing the disease. Where are we? And you're not completely shutting your eyes. I think that's the other problem, that people become fearful of one type of medicine over the other, and they just kind of, go tunnel vision. And that's only can hurt in the end. I think the more you listen to different opinions, and then you pick the things that are in alignment with your values and what feels right, but still always sort of like, keep checking back, then if you're on the right track or not.
Absolutely. And like we're saying though, but if you're trying something new and it doesn't work, you can keep trying something else. You always say to people, I don't say to people, I will never be one to say don't do chemo radiation, but I will be someone that says leave your options open and do other things as well. So I'm a big advocate of that. I don't care what it is. You try other things as well. If you really are pushing for chemo radiation, that's your decision. However, step back and try other things as well, because other things will help you along the journey. And like you just said, fasting done in a professional manner with a professional, you could do while you're doing chemo. So there are different things you can do, not just the one like you're saying, no, my doctor just says this, I'm just going to hold on to this, because you miss out. You miss out. So what worries you the most about working with cancer patients or breast cancer patients?
Yeah, and I'm, at this point, if I'm seeing cancer patients, it's, as a holistic or internal medicine doctor, so I'm not managing their cancer directly. But I think just, making sure that they're really kind of looking at all the options. A lot of what we've discussed already, not falling into a trap of going with one provider because they sound like they're selling something fancy and selling miracle cures and closing their options to all that can help them. So just having an open mind, getting high level advice from whatever type of provider they're seeing, and not falling to the hands of some people who are doing faulty marketing to claim that they know more than they do.
Yeah, that's really important. Like, do your research on who's behind it. It's really, really important to do that. Like I remember my surgeon now is my second opinion. So, and I remember when I interviewed her, I said, well, what are 5 things that people should do? And the first thing she said is get a second opinion. And she, as I said, she's renowned here in Australia. You put in breast cancer surgeon and her name comes up first. And it's not because of that. It happened to be my GP recommended my second opinion. He rang this doctor. I went and saw her. But she even said it. Make sure you ask the questions. Make sure you know what's happening. Be in control. Be in control of your journey, not give it all to someone else and just sit back. You don't do that in a car. You don't do that. You drive. You want to get from A to B, you drive. You don't just put your GPS and sit back and just hope everything works out. So you mentioned a book. So what's the title of your book?
I happen to have one right here handy. The Roadmap to Hospital Care. A lot of it is based on my experiences as a hospital physician and having a lot of family members with a variety of conditions, cancer and not. I think most of it, some of it is, of course, related to medical centers in the US, but I think a lot of it is general advice that would be applicable anywhere. But a lot of it comes down to what you just said. Speak up, ask questions. Don't think, the doctor's here and you don't know anything. You can do your homework, you can do your research, be prepared, go to appointments, organize, get your questions answered, advocate for yourself. And if you can't, take someone that can help you do that. But really, I mean, with the state of healthcare in the US, I mean, if you're not advocating, I worry. I worry about what could happen. It could be the difference of life and death, and you gotta fight.
Yeah.
You
And
gotta
you got to be
fight.
in control. Yeah.
You gotta be in control. You gotta
Mm.
know that you have rights. And when you're hitting a wall with a certain clinic, with a certain doctor, I hope you have the opportunity to know that that's not going to work here with this person. And one of the things also, we talked about second opinions a lot, and I'm glad that you said what you just said about your doctor. But if you ever say, I do want a second opinion, and that doctor gets upset, because I've had that happen. I've had a doctor actually yell at me, upset, saying, who's the captain of this ship? Why did you go to other places? This is the head of a department, very respected. And that was it. I will go. It is my right to have a second opinion. If someone is upset, that should be a red flag. That should be a red flag, because a good doctor will want you to get the best care, whether they can provide it themselves or not.
Absolutely. And I had the same problem with my oncologist, believe it or not. I spent 5 hours waiting to see her. I was the last person for her to see. And I remember questioning her, asking her questions. And I said, look, I might try something else as well. And her words I'll never forget was, you need to get out of my office because I don't have any more time with you. And I remember saying the word, wow, thank you for letting me see who you really are. And I walked out of there thinking, wow, that was really disappointing, because I said, I'm going to look for another way. I'm going to look for another opinion.
It's really stressful and heartbreaking, and it's really upsetting. But like you said, it also, those opportunities show you that person is probably not the best person for you, because this is your partner. This is not the doctor. This is your partner. And who's going to be the best partner to navigate your health? So
absolutely. Yeah. I mean, when I went, because I did the right thing. What we're saying is I went and did my research. I was told to do chemo, tamoxifen, the tablets, and to do radiation. Now I went to the radiologist and I asked him a million questions. All right, maybe 20, not a million, but he answered all of them. And then in the end, he said, it's up to you what you decide to do. And I remember feeling like, thank you. Thank you for allowing me to take that information and walking out of here knowing I'm in control of this, what I want to get done. So I looked at all the pros and cons. A disclaimer, I always say, in my diagnosis, the cons were higher than the pros. So I had to be mindful about that. So I decided not to. Again, when I went to the oncologist, same thing, tamoxifen. In my case, my sisters begged me not to take tamoxifen because my mum got a secondary cancer from it. So I walked in there saying, what are my options? My options were getting less and less and less and less without so many cons, so many other problems. So, and like I just said, and when I asked, well, I might try something else, get out of my office. I don't have time for you. And it was like, wow, that really shocked me, because like you're saying, you're supposed to work with me. Why did you just throw me out, pretty much. And I always say that, work with your oncologist. Make sure your oncologist, and I've heard, so I work with women who have actually said to me, Grace, can I have you on the call while I'm in my doctor's office, depending where they are, interstate and all of that. And I hear some oncologists and I just think, what are you saying? What are you saying? You're supposed to be working together. And what I'm hearing is their authority over them. Well, you got to do this, because if you don't do this, you only have 6 months to live. And you're not working with me. Would you say the same words to a family member? No, to a family member, you're going to say, whatever it takes, we're going to find the best treatment for you. You know, you're not going to sort of say it like, well, just listen to what I know better than you. Like you said before, who's the captain of the ship? That makes you feel already like, and see, you and I will probably go, okay, that's red flag. Someone else thinks,
Next.
yeah, well, we think next, but someone else might think, oh, how could I have done that? I'm so disrespectful. He knows best or she knows best. And they just submit to it.
Well, you were right. I never thought of that, but actually my feeling about that doctor was, for me, that's it. That is not someone I want to work with. And actually a different member of the family was like, wanted to continue, but you know, you gotta, I mean, it's a more complicated conversation of the reasons behind that. And I think, again, it's sort of like, oh, that's the doctor and that's the authority. How could I second guess? And I'll tell you, being a physician doesn't take that. I mean, still, like I said, somebody was telling me that the same thing that they would. So it doesn't protect you from having hostile doctors say, what are you thinking? What are you doing? Get out of here. And again, I don't know the system there, but the visits here, to the defense of the doctor who here may be seeing 20, 30 patients a day, sometimes time is limited. And one of the other things that I advise patients on is, if you have 20 questions, at least be prepared with your top 5, priority that you better have answered. Like, you have 20 questions, make multiple appointments. Maybe you need to go 2 or 3 times to get them all answered. But the doctors, unfortunately, are under a lot of pressure, and a lot of our time is, behind the computer charting, much more so than we're spending with patients. So, you do the best that you can, and you go in prepared, and you say, well, I really want these 3 questions answered. And then you make another appointment and go down the line.
Well, that's what we're both sitting here, and I think you would agree with me. Sometimes when you're diagnosed with, when you're diagnosed with breast cancer, I can say, unless it's a life-threatening that's going to kill you the next day, I always say to people, you got a week. You got probably 2 weeks. Like when I asked my doctor, can I have 2 weeks to think about all this? She said, take all the time you need. Now, that tells me that I could take the time I need. I'm not saying to everyone, like, just go and take 2 weeks. Ask your doctor, can I have a week off? Can I have 2 weeks off? In that case, you can go back and you can put your questions together, or you can spend that whole week, like we're saying, contacting your doctor or making an appointment every second day with more questions. I need these answered. I went and saw my first breast surgeon 3 times. And I was like, yeah, I need a second opinion now. And I went and saw my second opinion, and I saw her like the 3 times or 4 times before I did. Well, actually, again, disclaimer, I got diagnosed in August. By the time I had a lumpectomy, it was December. That's how much time I knew I had. Having said that, I still did my mammograms every couple of months. I still did my ultrasounds every couple of months. I still did MRIs every couple of months. So it's not like I just left it. But I just kept going back to, okay, I need to know a little bit more about my diagnosis before I do anything. But again, I went and saw my doctors several times, over the course of that whole time. So I'm not saying to just go, oh, hey, doc, I'm taking time off and not going back. No, that's not what I'm saying. Take some time. Like you said, think of your top 3. If they're so busy, think of your top 3. If not, say, listen, I need more time with you. Can I make a 45-minute appointment with you as opposed to a 15-minute appointment? Because I have some questions that I really I want them answered before I make a decision. But don't let them also, like you're saying, override that. Like, oh, well, you don't need to ask these questions. This is what it is. Yeah. Because that, you want to feel comfortable. I always say, you don't buy a house from the outside. You don't buy a car from the outside. So why would you do things from the outside? Look at things from the inside. Have a look. Ask the questions. How does this help me? How does having that not help me? Ask the questions of also, people think of that whole, I'll just ask the question now. So how is my operation? How long do I have for recovery? And whatever it is. No. ask the same question to your oncologist. Where would I be in 5 years from now? Where would I be in 10 years from now? What are the what are some things that could happen in 5 years? Is there a high chance of a secondary cancer? Ask all these questions because you want to know what you're putting in your body before you do it. So then when you are going through it, you are in control and you feel better about it and not, I don't know what's happening to me. I'm not in control. My doctors are telling me to do this. My doctors are telling me to do that. That's when you don't have control over your body or your mind or your spirit and you're just giving up, so, and hoping for them to heal you and not you heal yourself as well. So
Yeah,
I think it was really important.
I think this is something that I thought about before, in that I'm not sure always the doctor or the doctors mentioning how much time is reasonable to take to make the decisions. But as the patient, you could also ask, okay, you think X, Y, and Z is important. So how much time do I really have? In your opinion, like, do I have a month to decide? Do I have a week to decide? I think that really helps kind of put things into perspective, because I don't think that question is being asked enough times. It's like, well, hurry up, make a decision, let me know. But what does that mean? 2 days, a month? So you always want to know, like, how urgent is my, case? And is the cancer, about to go into a major structure or blood vessel or erode into my stomach and I may bleed at any moment? Like, I got to think quick. Or, because I think that puts things into perspective, especially for people who are interested in holistic treatments. It's like, oh, okay, the doctor said this, but I'll go and do this other thing. Well, you want to know the severity of things, because if it's earlier, if it's caught earlier, if it's not advanced, it's a totally different situation than a more advanced case. A large tumor in the brain, for example, then you may not have the luxury of time. So ask.
It's important to ask those questions. That's what I'm saying. Like when I said, can I have 2 weeks to think about it? And she was like, oh, of course, of course. I knew then in that moment, or my husband, because I was still in a bubble, I guess. But my husband knew, great, she's given us 2 weeks. Great, let's work with that. And then when I went back the second time and I said, well, okay, I need another 2 weeks. She was like, yep, that's not a problem. I already knew, again, what we're saying in my diagnosis, that it wasn't something of severity. And even when I went and saw my second opinion, it wasn't something of, oh, you must do it now. And then I that's the thing. I interview people that I hear where they go, oh yeah, from my diagnosis to a double mastectomy was like a week. But it was up to me if I wanted a double mastectomy, because the doctor actually didn't say I needed it, but I decided. And I'm thinking, what? I'm thinking to myself, what do you mean? You just got rid of your breast, which in their case, I'm talking, everyone's different. They didn't need it. A lumpectomy was an option. And they said, no, within a week, just do a double mastectomy. And I just thought, hang on a minute. So you're just dealing with what you're being diagnosed with, and then you're thrown into this double mastectomy, then whatever comes after that. And it's like, no, just
pause.
Think. Yeah, pause and think. This is a huge decision. This is huge. Like if I said to my husband, oh, I think I want to have a mastectomy, he'd be like, what for? What for? Your tumor wasn't that big, and to the point, well, by the time I had a lumpectomy, they couldn't find it. So, but again, disclaimer, that's mine. But what if I walked in and went, nah, do a double mastectomy? And then they remove my breasts, and then they go, oh, by the way, we didn't find anything.
We didn't need to.
You know what I'm saying? Like I've heard of women who had one breast taken, and then they go, you know what, I wish I had more time to think about it because I didn't need it done. And I think, take a break, pause, like you said, pause, just sit back and look at the bigger picture. Now, was there anything you wanted to share with us? Anything we didn't touch on that you wish to share with us?
I think a lot of what we talked about is in various things that I've put out. My TED Talk is a lot about this, about pausing, about thinking, about not getting overwhelmed. So if you just look up my name in the TED Talk, it's exactly about this topic. Don't kind of let your limbic brain and panic mode take over. So that's all about that. Again, the book is helpful in terms of the nuts and bolts of what happens in a hospital, why, if you do need to go, and everything from like how to pick a good provider. We've talked about a lot of it, but it's sort of a little bit of a more organized fashion, and how just putting your records in order and having a plan and researching before things get into crisis, the stage of crisis is really important. Even things like who is giving you anesthesia when you have a procedure. Again, in this country, we have some options. It's not always an anesthesiologist. So these are like little details that are really important. And again, goes to ask questions, know what's happening to you, have your records in hand, and fight for the good care that you deserve. I think we touched on so many of the things that I'm very passionate about. So I thought it was a very, very worthwhile conversation with a lot
Absolutely.
of good.
Sometimes we need to have these conversations.
I appreciate. You've experienced this, so this hits near and dear to both of us. I've sort of taken care of family and friends, and so you learn a lot navigating this.
Yeah, but that's what I always say in all my podcasts. What we learn has to be shared. That's the thing. So you sharing, this experience with your friend has brought you into a new sort of way of thinking and understanding. And you have now both. You actually sit with both sides, so you're an even balance. So you understand the Western medical, but you also understand the holistic side of things too, which I think is beautiful. Works perfect together, absolutely perfect. So you having that is very rare. Let me tell you, it's very, very rare because not everyone, like we were talking before, understands. Holistic doesn't understand. Sometimes holistic even says, don't you dare go and do radiology, or don't you dare go and do a biopsy, and don't you dare do this because well, how would you know? How would you know? So, and it's the same with someone in Western who's like, oh no, don't take those herbs because those herbs aren't good. What would you know? You're not educated. So you are a rare gem. Let me say that. You are a rare gem. And I really, really appreciate you, talking about this, because it's really important to bring the two worlds, together. It's extremely important for someone's. If I think I heard, and you can correct me, that doctors take an oath. And, it's basically saying, I'm there to help you and not there to make your life worse. So I'll do whatever it takes to help you. Yeah, I'm not saying the oath off, but like word by word, but that's what a doctor's position is to take an oath to help, not to take an oath to become richer or to, keep people in limbo or misinformation or pretending you know one thing and you don't. It's there to take an oath for the good of others. So I think your service is definitely what's needed. Absolutely.
I think everyone who gets into this field, just what you said, everyone wants the best. I think, sometimes you know what you know and you don't know what you don't know. So sometimes providers can have tunnel vision. And I learned this early on when I started doing holistic medicine. I worked in an office full of acupuncturists and herbalists, and I was the only Western trained doctor. And I thought it was always the Western trained doctors that did not like or believe in some of the alternative therapies. I didn't realize it was both ways. And just like you said, if you're seeing an alternative practitioner who's just saying acupuncture is the best way and don't go over here, they're going to hurt you. I think you can see that tunnel vision regardless of who you're working with, and that those should be red flags, because in the dream world of medical care and healthcare that I see, we would have a team of all these different kinds of wonderful, healthcare people working together and knowing what an important role each one of them fills and respecting each other. That is what I hope as we move forward. But it's an evolving field.
Might take a little longer than we want, sort of thing.
I don't know if it'll be my lifetime, but that's what I hope for.
Yeah, well, but it's true though, because working together is so important as to working apart. Because that's the thing where the patient is who you're looking after. That's who's like you. This is who we're going to look after. So put your own opinions aside, so to speak, and bring in your expertise in it.
And egos.
And ego. Oh, especially ego.
Those big egos. And we're all trying to help the patient. So, we're working together and the patient feels supported, right? If you can get people who are communicating, then, you can only get better outcomes. So I hope to see that more and more.
Yeah, and so do I. Honestly, I do too. I was really, really excited when, for the first time in 6 years, my surgeon actually said to me, "What do you think healed you?" And I was like, I wanted to just go over and give her a hug. Welcome. But I said to her, I needed to change the way I was thinking and feeling, and I had to get rid of stuff that was no longer serving me, the traumas that I was holding on to, and things like that. And for the first time, she actually listened to me. And I thought, she's getting there. Slowly, she's getting there. Because she's not holistic, but she's getting there. But when we say holistic, it's a huge umbrella. Yeah. She's all about how much exercise. She's all big about exercise. Grace, have you moved? She's not expecting me to become the world's best marathon runner, but she doesn't want me to be a couch potato either. So she's always saying, how much are you moving? How much are you moving? How much are you walking? She doesn't care if I'm overweight or I'm a big girl. She's asking me, how much are you moving your body? So I get what she's saying. She's there already, but it's the things now. And she actually, I was so grateful. I left one of my books there, one of my journals that I have in there, and she read the first page and she did a video on Instagram and she said, this is what people need to really do. And I remember looking at it and I'm thinking, oh my gosh, she's pointing at people have to start changing the way they think. They have to be, we could say positive thinking, like one of my mentors, he doesn't go outside going, there's no weeds, there's no weeds, there's no weeds, and it's going to go away. No, there's weeds. We've got to get rid of them. But it's living in a different mindset. It's living in a more understanding mindset, a positive mindset, as opposed to this isn't going to work, this isn't going to work, this isn't going to work, this isn't going to work. So yeah.
And a positive mindset. I mean, again, sort of in Western medicine, our bodies and organs are in different silos, but what is a positive mindset? It's just not what's above, the head here. Not positive mindset. It creates millions of chemical changes, things affecting your hormones, your gut, your stress hormones, where you store fat. So it's having real physiologic impact. It's not just, oh, I'll think positively and it's just in my head.
Yeah, no, but that's the thing. It's the physiology of it all. It's changing your physiology. It's like you said earlier, how you got to look at it. I forgot my train of thought, but it was like basically how you have to look at it and not just think, this is something that's bad. Look at it, the whole thing, and understand. I'm really like probably misquoting you now, but I lost my train of thought then. But it was along the lines of, you're going through it, but just make sure that you understand that it's okay. You're going to go through it. You're going to be okay. Let's go through and find what's best for you and things like that. I always say, put you in control. Put you in control. It gives you that. If you're in control of a project, you feel so good about it. Well, if you want to look at this as a project for yourself, look at it that way. Be in control. Be in control of makes you feel good. you
And
know?
I think a lot of the holistic modalities or treatments really put a lot of the control into your hands. I think, when we're okay, well, you get chemo and surgery. The patient really isn't involved too much in that. But when you, especially after the cancer treatment is over, you touched on this briefly. It's sort of like the surgeon's done with you, and the oncologist may say, come once a year, we'll do another mammogram, let's say, or CT scan. Well, then what? Then what? Now you may be on medication that affect, if you're on tamoxifen or like medication that affect your sleep or your bone density or your anxiety or your depression. Who's dealing with that? And I think the integrative holistic world really gives you the tools, kind of opens the toolbox a lot more to give you what you need to put you back in control. And I think the people like us who know that and have utilized that know that there's a world out there. And then others, some people that are just, unfortunately, again, sort of what insurance covers is sometimes what people are limited to. And a lot of these holistic modalities are more out of pocket. So sadly, it is not an option for everybody, but there's still, you can do much. There's still a lot.
Well, there's things like, yoga you can do from home. I think everyone in the world has a phone. You could watch a YouTube. You could do meditation.
Yeah.
You can watch someone do it. So there's all these things that you don't have to pay for as well that you can help change. Journaling, you can journal. I journaled. I've got so many journals of all the last 6 years, if not longer. I do other things to help me out. So, it is important that people understand that as well. Yeah.
And it makes a difference. And all of that makes a difference.
Does. I really, really enjoyed today's podcast. I really did. And I could talk to you for hours and keep going. So, because there's so much, but I will make sure that I will post all your links on social media, so Instagram, Facebook, as well as your book, The Roadmap to Hospital Care. I'll make sure that people can purchase it on what platform, or do you have a website? Amazon?
Yep.
Perfect. And also I'll make sure I have the link to your TED Talk as well, so people can watch that as well. So I think it's really important that people understand what we're trying to say to help them. That's at the end of the day, that's what we're trying to do is to help the patients or help the person through their journey. So is there anything else you wanted to share with us before we leave?
I think we said it all. This was a lot of fun. I know it took some time to figure our different schedules, but this was a lot of fun and I really enjoyed it.
So did I. Thank you so much. I really appreciate you being on my podcast. And like always, I hope you guys enjoyed today's podcast. And I leave you by sending you so much love and light.